sometimes aerobic exercise leads to changes in the protein level of urine. A small amount is normal, but a large amount of protein in urine may indicate kidney disease.
Only thing is that the reliability of the tests have to be a certain.
Measure the accuracy of the fasting.
What a title. Hope. The meaning of the title is hope.
So what I would request everybody, see, sky is the limit.
You will have 10 minutes for presentation and 5 minutes will be for discussion.
Today is absolutely a very special day for international conference.
Warm greetings from Esperanza. Let your hope shape the future.
This is the first time an institution jointly organizing an international conference with paper presentations.
The fact is that sport brought them together for that short period.
You are the people who will make the change. Don't wait for anyone.
You can see whether they're challenging enough, and you can see whether they get on well together, as in a team.
Technology will deliver seamless and integrated results that will enhance the sports experience.
As we all know that
Unmute. No, don't unmute. Don't unmute, Phil.
Warm greetings from Esperanza. Let your hope shape the future.
This is the first time an institution jointly organizing an international conference with paper presentations.
The fact is that sport brought them together for that short period.
You are the people who will make the change. Don't wait for anyone.
You can see whether they're challenging enough, and you can see whether they get on well together, as in in a team.
Technology will deliver seamless and integrated results that will enhance the sports experience.
As we all know that whenever we are talking about the sports, so we are going with some sports movement and some physical movements.
Hoping that Esperanza 2020 would be indeed a hope that would be cherished throughout the pages of history of both the institutions.
I am honored and I am humbled to introduce Mr. Vinay. He is a veterinary wellness coach with an enviable client list that includes elite sports professionals, musicians, business tycoons, Middle Eastern royalty, and world leaders.
Nothing different. We all have a journey, but only thing we need to look back to that journey to create something.
Really demanding extra training for interpretation program to improve executive functions of the children with attention deficit hyperactivity disorder.
Consistency value based on perceived rating and self-rating. The perceived rating player assessed predicting his own score out of 10.
Aerobic exercise leads to changes in the protein level of urine. A small amount is normal, but a large amount of protein in urine may indicate kidney disease.
Only thing is that the reliability of the test have to be certain.
Measure the accuracy of the fastest.
What a title! Hope. The meaning of the title is hope.
So what I would request everybody is sky.
Silva, please start.
Hello there, warm greetings from Esperanza. Let your hope shape the future. Welcome to the third and final day of our international conference on a glimpse into the future of sports and allied science sectors, jointly organized by the Physical Education Departments of MES College Marampally and CHMKM Government Arts and Science College, Thanur, Kerala, in collaboration with Longford College, Ireland and FA Innovations, UK. Warm welcome. Thank you all for joining us. So for the past 2 days, we have been listening to eminent personalities like Professor Flomni Menon, Professor Vincent English, and Mr. Vinay Menon deliberating in the area of sports and physical education. And all those valuable insights really gave us a new perspective that we all should adopt while discussing these topics. And today we are joined by the very special Dr. Farha Saeed. She is a consultant of fetal medicine, obstetrician, and gynecologist. Really looking forward to hear her session. So without any further ado, let's get straight into the program. And now let me invite the joint coordinator of Esperanza, Mr. Sujit Babu S., Assistant Professor from Department of Physical Education, Government Arts and Science College, Ollur, Kerala, to deliver the welcome address. Please, sir.
Can you hear me?
Yes, I can hear you.
Okay. Good afternoon. I am Sujit Babu S., Assistant Professor in Physical Education, Government Arts and Science College, Kollur, Thrissur. Today, on this third and final day of Esperanza 2020, I am here to formally welcome you all to this function. Before that, let me take this opportunity to appreciate my friend, Mr. Hanifa, for such an initiative, and Mrs. Sindhupi and Srinath, they were my colleagues, and all other team for their wonderful work and their efforts. Let me come back to the duty bestowed upon me. It's my privilege to welcome Dr. Farah Saeed, MBBS, FRCOG. She's a consultant fetal medicine obstetrician and gynecologist by profession, working at Barts Health NHS Trust. She's an honorary clinical senior lecturer at Barts and London School of Medicine and Dentistry, Queen Mary University of London. Dr. Farah Saeed published research on fetal medicine, dysplasia, transverse limb defects and COVID screening in pregnancy. She has expertise in preconception counseling, screening of prematurity, fetal medicine scanning, early pregnancy, and gynecology scanning. She's actively involved in local, regional, as well as international teaching and training programs and has developed many training projects. She has a special interest in areas of women's health and wellness. So she has taken the subject. So the topic of today's speech will be wellness of women in sports. So I cordially welcome Dr. Farah Said to this session. I am honored to welcome the eminent personalities of physical education. I would rather say the stalwarts of physical education, the directors of physical education of various universities of our state and LNIP Golur as well. We are lucky to have them as our technical experts. I welcome Dr. Wilfred Vassar from LNIP Golur, Dr. Zakir Hussain sir from Calicut University, Dr. Dinu MR from Sri Shankaracharya Sanskrit University, Dr. Binu George Varghese, Director of MG University, Dr. Manoj KP, the newly appointed Director of Kannur University, Dr. Jayarajan David, Director of Kerala University, and really happy to have all of you with us. And I cordially welcome all the delegates and all the participants to this program. And again, I would say, when my friend Hanifa is at the helm of affairs, we can expect more and more programs such like this. And thank you. Have a nice day. Over to you.
Thank you, sir. Thank you, sir. Thank you so much for the earnest welcome address. And now, before the session begins, I would like to inform the participants if you have any queries or doubts, you can just post it in the chat box. So now, let me invite Dr. Farah Said to begin her session. Please, ma'am, session is all yours.
Thank you very much for inviting me. We had a little bit of technical hitch, so I'm waiting for a presentation to come on from your side. That's perfect. I can see my presentation now. So as I have been introduced about myself, that how and where and what I do, I am a gynecologist and obstetrician and work with women. And somehow when Floney spoke to me about this huge and wonderful work which you're doing, I thought I should join hand and try and come and give my perspective from the woman's point of view. I usually deal with pregnant women, and I believe in many of the society and many of the environment, when you look at these women, you think, okay, this is the only opportunity I'm seeing this woman, huge opportunity where I can tell them about the different kind of lifestyle, a healthy lifestyle, which can not only change their own health, but also the generation to come. Next slide, please. So there has been a lot of literature. People are interested because as women, we spend almost 1/4 of our life in our reproductive age where we are pregnant or have given birth or planning a pregnancy. And therefore, this is a whole decade where you have to really have some kind of understanding that can we carry on doing exercises? Can we introduce exercise concept in women during this time? So people have been talking about having nutrition, physical activity, and looking at the behaviors, knowledge, and advice in pregnancy. And what we have understood that healthy pregnancy behavior recommendations are not being met, and people are less likely to meet some recommendation. My problem is, are we recommending them? Because we are devoid of knowledge about the healthy physical activity in pregnancy. There have been bold people who have been running big randomized controlled trial to understand the diet and exercise in pregnancy. Next slide, please. So the facts are that more than 2/3 of pregnant women take part in some kind of recreational activity and only 15% exercise at a recommended level. because there's a positive advice. We don't know what to say. Our confidence is lacking knowledge. We have not seen this kind of avenue where we can advise women about physical activity. So the only 15% get the recommended advice. There has been, however, a critical shift in recommendation regarding the prenatal exercises from potentially harmful effect of the exercises, what we used to think, to a critical prescription of exercise to the mother and for the benefit of the baby. Next slide, please. People do ask, why can't I exercise during pregnancy? Prenatal exercises or exercises during pregnancy guideline now all around the world, and they recommend without any contraindication to engage in regular physical activity throughout pregnancy and after postpartum period. Now, these recommendations are now personal choices of those people who have interest in exercises like myself. However, these have been based on a lot of literature that supports the safety and benefit of these exercises. Next slide, please. Now, what have we done to our population of women who think they are going to be pregnant, or they are pregnant, or they've just delivered babies? Because we haven't recommended them or advised them enough, what has happened that people have started thinking that not having a good activity in pregnancy is actually saving their babies. And therefore, bed rest somehow come into the practice. And almost 87% of physicians in North America was still prescribing bed rest for high-risk pregnancies for lack of better therapeutic option. The problem is that majority of physicians, they do not provide any other rehabilitative exercises which may alleviate some of the negative side effects. For example, excessive weight gain, diabetes, which can come with bed rest, and then you have all these complications associated with diabetes and pregnancy. Next slide, please. Now, we carry on with maternal obesity, excessive weight gain, and lifestyle behavior. If people gain weight during pregnancy, if they don't do exercises during pregnancy, it actually embeds into your personalities, and you have overweight throughout your life, and adverse health come not only during pregnancy and the babies, but also for your own life benefit in 10 and 20 years to come when you develop diabetes and hypertension and all complications associated with these problems. Now, it's happening because we didn't have knowledge. Our problem is that we did not go into the depth of the sports and physical activity during labor. And we thought delicacy and rest as a form of something coming up with pregnancy and after delivery. Next, please. So the question is, exercises, are they beneficial during pregnancy? Yes. Next slide, please. This is regular exercise has got a potential to reduce the risk of developing diabetes. And most of the colleges, including American College as well as National Institute of Clinical Excellence UK, which is commonly known as NICE, they set exercise for 30 minutes, for example, cycling 3 times a week, causes significant reduction in frequency of gestational diabetes. That means diabetes which develops only in pregnancy, in overweight and obese women. And if you have decrease in gestational weight during pregnancy, actually that reduces the chance of developing diabetes. And it doesn't come with any kind of complication. There has been no literature to suggest that it increases the risk of baby born before their time. Now, we clearly know from the literature that if you exercise during pregnancy and even weight-bearing exercises, it reduces the risk of high blood pressure in pregnancy, diabetes in pregnancy, and above all, it actually reduces the depression as in any non-pregnant human being. So when you get involved in a lot of physical activity, it actually brings good mood and motivation in your personalities. Now, when you have a pregnancy, there was a very interesting hypothesis in around 30, 40 years ago. It calls Barker's hypothesis. And that Barker's hypothesis, it tells you that When the babies are in mommy's tummy, actually their future is programmed according to the nutrition they receive, according to the environment they have, according to the activity of the mother, or according to the whole phenomena of physiology which is going around the mother, actually sets a future for that baby. That's called Barker's hypothesis. That means there's a fetal programming which can happen. So when the baby is inside and you have malnutrition, baby will have effect all their lives. If you have a lot of weight gain during pregnancy and you develop diabetes in pregnancy, actually that leads to increased weight gain of that baby. And that effect is not only going to have effect on the delivery complication, difficult deliveries, injuries during deliveries, but also these big babies, when they are born and live their own life, they have a high risk of developing diabetes, hypertension, and other metabolic syndrome. So it's so important that you have all these programming set up to have healthy and active human beings after you have given birth to them. Next slide, please. There have been concern that when you do exercises, actually your blood vessels dilate, and therefore they contain the blood volume that leads to reduction of blood volume towards the baby. And therefore baby might have little less weight gain or might have growth problem. But all these have been only theoretical theories where we don't have any literature basis to confirm that. So these hypothetical concerns that high intensity exercises during pregnancy leads to preterm delivery has been excluded in literature. It does not cause any effect on the baby's heart rate. It does not cause any stress to the baby. And also this heat generated by exercise does not have any harmful effect in terms of structural abnormality in the babies if you exercise high intensity in early pregnancy. So that actually reassures you that we have a lot of opportunity in pregnancy, because if we are seeing a woman and you're talking to the woman, you're giving them a setup, not for only pregnancy, but all their lives and life beyond them, which is the life of their children and generation to come. Next slide, please. So pregnancy is an opportunity to optimize women's health behavior. Exercises could act as crucial intervention to improve health outcome for babies and mother in short term, as I said, during delivery and birth, but also later on. So this slide actually shows you the recommendation from American College and National Institute of Clinical Excellence in UK. And both of them, these two big colleges, which bring a lot of recommendation for us to practice, actually recommend that we should be involved in physical activity. And they say most of physical activities are safe, apart from those which brings a high impact or there's a risk of fall, for example, ice hockey, saucers, basketball, gymnastic, horse riding, downhill skiing, because they think when you have a fall, there's a risk of detachment of the placenta from the uterus, and therefore leading to complications like bleeding or preterm labor. But if you're doing exercises which are well controlled, if you're doing exercises which are even being heavy exercises, if you're used to of them, you must carry on. There might be a little bit of reduction in the volume of those exercises to help you to kind of compensate for the pregnancy-related postures. However, if the exercise does not have any high impact, as if you have a risk of fall, you should only avoid those exercises. But all other well-being, weight-gaining exercises can be done very, very safely. We also tell the women that do not exercise if you are anemic, because if your iron levels are low, and if you do exercises, there's a risk of a little bit of feeling unwell, or you feel like having a collapse. So therefore, we advise not to exercise if your iron level is low. If you have known case of cardiac disease or a known case of lung disease, obviously we would not like you to exercise. People who have a lot of weight, morbidly obese patients who are pregnant, because their metabolic rate and their balance could be quite riskier if they're exercising on their own. We don't say that you don't exercise, but you don't exercise on your own. You have to be exercising under supervision. Similarly, if you have a very small weight, a BMI, then you have to be under supervision because you don't have much of a reserve to lose during exercise. If you have had a small baby on board, we don't have any literature. However, we say, be careful, don't do exercise, try and save energies for your baby. If you have known case of having a preterm labor, baby being born before birth, then it's be better if you exercise with the discussion with you of your physician, because if your neck of womb is weak, exercises may stimulate labor. Similarly, if you have bleeding in the past, or if your afterbirth is lying below the baby, we call it placenta previa, which has got a risk of bleeding, we said don't exercise and come to us and we will tell you something where you don't involve so much in your changing the body gestures or standing long time. But we have to be really modify and tailor the exercises according to the woman. So straight away saying, oh, you're a high risk, don't do exercise, does not help the woman, does not help their generation. So please be careful and try and be open about exercise in pregnancy. So I think we are learning as well as physicians that we have to be confident within ourselves. We have to start believing, and if we start believing, our patient will start believing in sports and exercise during pregnancy. Next, please. So there is a very interesting literature where athletes were studied with other active control young women, where both group actually shows decreased training volume in all trimester because they were advised to reduce the amount of weight training they were doing before pregnancy. It was reduced to slightly lesser, safer amount. There was no difference of these women getting pregnant. There was no high risk of miscarriage. There was no high risk of any baby being born before time. And there was no high risk of baby delivering in a smaller weight than other women. Now, getting pregnant was easy. Delivering healthy babies were very common. They did have a little bit of less training. However, they went back after delivering the baby and coped with the retraining to the similar kind of activity which they had before delivery. So if somebody is already doing some weight training and they come pregnant to us, we say you can carry on with some reduction. However, you can go quickly back to your normal routine once the baby is delivered within a couple of weeks. So it's quite reassuring to see that athletic women have no problem getting pregnant or having any complications related to their weight training, even during pregnancy, however, in slightly smaller volume. Next, please. So we have examples. We have Martina, who has had ice skates, and when she was 4 weeks pregnant with twins, look around, she's doing all the activities. So these are reassuring examples of activity in pregnancy and its safety. Next, please. And we see Carrie Walsh, who actually has volleyball superstar, and she was 5 weeks pregnant when she actually took part in Olympic Games in London in 2012. Next slide, please. Then we have Amelie, who actually on the snowboard when she was 8 weeks pregnant. People are frightened to even move when they are pregnant. Look at this woman. She's so confident that doing exercises in pregnancy is safe if they don't have any contraindication. Next, please. We go on and we have more advanced pregnancy. You see Anita, you think volleyball, my goodness Christ. She has a real bump there. And there is a 4-month pregnancy when she had actually 1996 Olympics. So these are examples for us to be reassured, to say that you can carry on with your exercises and your sports. Next, please. Now, this is the heavy stone pushes. You can see the woman, Christy Moore, on the left side. You can see the bum, 6 months pregnant when they were pushing a heavy stone. 2010, Olympics. Olympics is full of those examples. We should be reassuring our patient about exercises and activities during pregnancy. We have to get them being part of sports activity throughout pregnancy. That actually helps in pregnancy and labor. So to summarize, moderate exercise is encouraged in uncomplicated pregnancies. There is no evidence that exercise can harm the mother or her baby. Women who exercise intensely during pregnancy need more studies. We have to have some kind of trials where we can see a variety of women having variety of different exercises. So we can make up our mind what volume, what weight, and what kind of exercise is specifically designed for a specific kind of woman. Physical activity increases flow-mediated dilatation, and it actually does not harm the mother, rather it decreases the risk of preeclampsia, which is a hypertension disease in pregnancy, quite a killer. It prevents the weight gain if you do exercise. It improves the glucose control, and when you have a good glucose control, that means you don't develop diabetes, and those diabetes-related problems to the baby, that means if the babies are born to diabetic mother, they are heavier and can have problems during labor and after delivery in terms of their glucose control. And therefore, all these activities are actually giving you a lot of advantage rather than disadvantages. It may reduce the complications surrounding the birth of mother and baby, but also improve their future health, as I said. We're talking about generations. So pregnancy is an opportunity. Next, please. As I mentioned, that larger powered studies with consistent methodology are needed to distinguish between various types of exercises in diverse group of women at various stages of pregnancy. To be very specific, you can do this in first 3 months, not in the second 3 months or the third 3 months. We don't have that details. We have got a very vague kind of literature which says it's safe, but what kind of activity for what kind of woman? We have to go around and do a little bit of literature, little bit of research to understand the very meticulous detail about different kind of exercises. Therefore, we will be able to do some tailored exercise program for different women. We understand that maternal obesity is increasing. We are dealing with a generation where moms are heavier than they used to be 20 years ago. And therefore, GDM, which is gestational diabetes, that means diabetes developed in pregnancy, is high. And this exercise is a prescription to reduce the risk of diabetes and benefit women and their offspring and improve the health of future generations. In the meantime, since we don't have large power studies, we have to encourage women to do moderate or accustomed exercises in pregnancy as much as we can think is safe for them. Next, please. Seeing is believing. I've taken this from one of the internet website where pregnant ladies are doing squats, curls, and press. And they think it's a total body exercise, a great opportunity to keep them fit. There's a sumo squat, great opportunity to allow a more room for the growing baby in their pelvises. Happily doing exercises in pregnancies. Mummies are happy and babies are happy as well. Thank you so much for your attention, and I'm very happy to answer any questions if you may have.
Thank you, madam. Thank you for a wonderful presentation. Madam, we have some questions in the chat box. What is the recommended frequency of exercise for pregnant women? How many sessions per week?
So the recommendation from NICE Guidance, which is National Excellence Institute in UK, they recommend 30 minutes of exercise 2 to 3 times a week. And these similar instructions are from the American College of Obstetrician and Gynecology. So more or less 30 minutes of moderate exercise 2 to 3 times a week. However, if people are involved in the weight training, they can carry on the weight training. However, they have to reduce the volume and the strength of those weight training because they don't want to go ahead with a similar kind of intensity. They need to have expert opinion before they can go on to carry on with weight training. But somebody who's exercising moderate amount, for example, people who are running or cycling and they become pregnant, we tell them, okay, 30 minutes 3 times a week, you can still do it. I can't hear you, but I saw a question about yoga in pregnancy. I think you're mute.
Yes, that's a question about doing yoga during pregnancy.
Yes. So yes, you can do yoga in pregnancy, but you have to be careful. The joints in pregnancy are softened, especially the pelvic joints. Therefore, you have to go slow and try and check the postures if they are okay for you. We don't want you to have tenderness or pain on your pelvic joints. So go very slow. And when they ask you to maintain a posture for 1 minute, do it for 30 seconds and try and see if it's not painful for you. Something which is causing painful joint, you get some expert opinion. However, most of the yogas are safe in pregnancy.
Well, Dr. Faha, can you hear me?
Yes, I can hear you.
Well, this is Dino from Kerala. Well,
Hi,
I have few clarification. You are being introduced as an aesthetic gynecologist. So
Yes,
what has aesthetics got to do with the childbearing and fetal health? That is my first clarification.
Well, what is your name? I'm sorry, I didn't get your name.
I am Dino.
Dino.
Yeah.
So I do obstetrics and gynecology. So obstetric means I look after women who are pregnant, and I do scanning and I do their needle testing if there is a need, and I just deliver them, and that's the obstetrics. But if you come to gynecology is a women or women who are coming with some complaint about any other thing like menopause, if they're coming with their bleeding problems, if they have fibroids, all these things when the women are not pregnant. Now, there's a third part which I do is aesthetic gynecology.
Yes.
So we want to make our body perfect, and aesthetic gynecology is about making your body perfect.
Okay. And the second one is normally, if not under a supervised exercise program, how do a pregnant woman conceive a contraindication? And the third thought and the third clarification is on gestational diabetes. And what about the latent development of diabetes on an offspring? Are there any literature on that?
So diabetes is very common, especially in a woman with a background of Asian community. Unfortunately, we have a lot of truncal obesity, so our BMI might not be translating into the risks. So we have a risk of developing diabetes, and pregnancy hormone actually leads to a little bit of more. It unmasks our predisposition to diabetes during pregnancy. So we have a lot of literature saying that we are prone, therefore we screen them at the time of booking, we screen them again in the second trimester and try and see if they have diabetes. And if they have diabetes, we treat them and prevent the complication. Now, what I was trying to explain in my presentation, that if people are involved in a lifestyle with regular exercise and dietary modification, they may avoid becoming diabetic in pregnancy, because high BMI or weight gain before pregnancy or weight gain during pregnancy is a high risk to develop diabetes. That was my first explanation. Now, if we have a genetic predisposition, we can't run away from it. For example, I have diabetic parents, I have diabetic grandparents. I can't avoid it. The only thing I can do, probably, I can delay it. I would not develop it at my 50. I probably will develop it at my 70, because I have maintained a very active lifestyle and a very good dietary modification in my life. Therefore, I'm delaying that. But if I start gaining weight today and I stop doing exercises, I'm going to develop diabetes maybe within 2 months. So the similar thing actually happens in pregnancy. So you have an opportunity to talk to the woman. So when I talk to a woman, I talk about the life course, not only about that pregnancy or for that baby. I tell them, you have to love yourself. You are the most important person in your life. Look after your body. This is the opportunity because I'm talking to you. I might not see you again, which happens in most of the Asian background families. You only see doctors when you're pregnant or you have a real problem. So this pregnancy is a unique opportunity when you tell them, get better for yourself, get better for your baby, because if you develop diabetes, you have bigger babies, and your bigger babies, those babies are going to be bigger all their lives, and they develop diabetes and hypertension. That's the simplest thing I can explain about diabetes.
Thank you. Thank you, Farah.
I think somebody's raising hand. Somehow I can't see all the questions. So if you can, somebody repeat the questions for me.
What's the ideal time to start exercising? Is it okay to?
So anytime.
Yeah.
So anytime is ideal.
I mean, the first trimester, is it okay to exercise?
I think we should not leave, simple exercises. For example, if I do brisk walking, I should carry on brisk walking. Many people are unwell in the first 3 months because of vomiting, because of, all kind of feelings. So they might not do exercises at all. So second trimester may become a most favorite part when you start feeling better, you start thinking about your own self. So I think the first trimester is not bad, but many people feel unwell. So second trimester might be the time. The third trimester, you're too heavier, and people who are not used to too much exercises, they feel like having backache and all those things. So I think if we keep the muscle tone right, we can avoid all these postural problems as well.
One more question. Once after pregnancy is declared, how long would you personally suggest an athlete to continue with their intense training as well as sports competition?
It's a very, very important question. I am not a sports specialist. So if an athlete come to me becoming pregnant, I send them to a sports medicine person, because the amount of exercises they're doing it for a reason, because they're part of a sports which needs their attention when they're not pregnant anymore after a year. So I have to be able to preserve their muscles. I should be able to, avoid the wasting of muscles, and therefore we need expert advice. So they can carry on moderate exercises as per my advice for their weight training. There's a big industry of the sports medicine in UK, especially in London, and people can get expert advice about what kind of exercises can do. It all depends upon what kind of sports you're doing. If you're doing, for example, powerlifting, then I'm not the person to advise you how much can you lift. So we can have a combined conversation with a sports medicine person to decide how much can she do and how can we reverse the muscle loss after the pregnancy is over.
Yeah, madam, one more question. What type of exercise should we avoid at the time of pregnancy? Is there any exercise we should avoid? Yeah.
Any exercises that have a risk of falling. So if you're doing cycling, don't go hilly cycling, and same as Saeed has said, you can do hilly cycling, because if you fall, you can have an injury, number one. Number two, sudden jerky falls can lead to placenta, which is the afterbirth, attaching and giving blood to the baby. It can detach from the womb and can cause complication in terms of bleeding and distress to the baby. So anything which can lead to fall, anything which can lead to jerky kind of movement, we should be avoided. Smooth exercises are all fine.
Madam, about nutrition during pregnancy, is there any type of food we should avoid during?
Avoid too much.
Say you should yeah.
So I tell my women, if other women in your family are trying to feed you sugar, that means they're jealous of you. They want you to be converted into a big woman. So be careful. Have high protein diet. Have some carbohydrates, a balanced diet, but don't have juices and fruits like unlimited. You have to see how many calories are you eating and try and have some fat, some protein, some carbs. You can't carry on eating sugars. So I think they have to be watchful about eating too much sugary food, even fruits. You have to have a limit.
Hello.
Hello.
Yes, sir. Please carry on.
Yeah, I have a question. Partially, it is already answered. I'm talking about the participation in competitive sports. Like powerlifting, you have mentioned. For a training purpose, it's okay, but competitive powerlifting or maybe boxing or maybe such activities, body contact games, I think there must be a list of activities we must certainly stopping it. What is your opinion? Or maybe like bungee jumping or such activities?
I mentioned that I'm not a sport specialist. However,
Okay.
leading to jerky movements. For example, if I'm doing sitting boxing, I can do hit while sitting. So I'm not moving my body, but I'm maintaining the strength of my muscles. I think probably I can do it. But if you send me in the ring and practice, there's a risk that I might fall. So it's all very.
I was asking about the competitive sports. You cannot avoid such situations.
Yes. So it's a very huge multidisciplinary input. So as a obstetrician, I am the person who can deal with the pregnancy. And then we have a sports medicine expert who have to come into play. And we all have to have a multidisciplinary meeting saying, this woman has got pregnancy of this stage with no complication. She is participating in this competition. Is it safe or not? So we have to time ourselves according to the woman's type of sport she's in, according to the pregnancy complication she has, the stage of pregnancy, and timing of the competition. So it's a big conversation, and it has to be individually planned.
Yeah, even about yoga also, we say some of the yogic activities like topsy-turvy positions we should avoid during pregnancy and the life of you will also agree to it or not?
So pregnancy, it is a time that nature actually soften the pelvic joint.
Yeah.
So all the pelvic joint have more spaces during pregnancy. Nature is trying to prepare the delivery to make more space for the baby to come out. And therefore, all the joints become softer. When patients have painful joints on these areas, we avoid having any kind of exercise, even yoga. Because if you're maintaining postures where you're extending your joints, you may damage your joint, they become more painful for you. So therefore, it's individualized. If patient is completely fit with no problem, they can go for yoga. But those yogas, if you're maintaining the posture and they're painful for you, you have to stop.
Okay, thank you.
Thank you.
Srinath?
Yeah, Srinath.
Hello, Srinath?
Yes, sir. Yeah, one more question is there.
There is a clarification from Tessie Ann about
yes,
therapeutic. Please post it to her.
Will there any problem in future for athlete if she is delaying periods? Yeah.
Delaying periods?
Yeah.
No, I don't think so. Delaying period is very common. So we give prescription for different reasons. People are attending their interviews, they're going for sport, they're going for hiking, they're going for Hajj. There's so many reasons we give medications, and delaying period occasionally does not cause a long-term effect.
Yes, thank you. Thank you, madam.
Thank you.
So, Dinu sir, can we wrap up? Dinu sir?
Please.
Yes. Farha, over to you. Telva, over to you.
Hello. So I'll say goodbye.
Thank you.
Is that all right?
Yes.
Well, can I ask Professor Wilfred Was to sum up?
Sir,
Sir, please unmute. Wilfred, sir, please unmute.
Your microphone is muted, sir. Sir, please unmute, sir. Yes, sir.
Is it okay? Can you hear me now?
Yes.
Yes, sir. Yes, sir.
Yeah, Doctor, it was an excellent topic of the year. Of course, we have heard lots of things about, olden days people were not that caring and taking caring, and they were very usual. They were into usual lifestyle. But now, with the advanced technology and all, we have become very, 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 over taken care much, and with that there are so many problems. But now, of course, again the exercise is coming back, and people are being educated to go for the regular exercise and things like. So in fact, there will be many questions and doubts to be clarified, but the time limit is to be taken care of. So we all enjoyed your talk. In fact, even I had so many questions to ask. I noted down many questions, but time is a limit. So thank you very much for delivering this speech, and I congratulate the organizers for inviting her and her presence and her presentation in this program. And I hope the participants, the delegates, have taken the maximum advantage out of it. Thank you very much, ma'am, and I thank all our organizers for this talk. Thank you very much.
Thank you. I can leave my email to Flonnie, who's a good friend. Have any questions, you can send the question to my email, and I would be very happy to answer all the questions.
Excellent. We would love to ask many more questions to be clarified by you. Yeah.
Yes, thank you, Wilfred, sir.
Thank you.
Thank you. Selva, please.
Okay, sir. Thank you. Thank you so much, ma'am, for the wonderful session. Your presentation was amazing. It was really instructive and informative. And thank you once again for the wonderful session. Thank you, ma'am. So now that was the end of our first session, and now we are moving towards our technical sessions. And for that, I invite Mr. Srinath S., Assistant Professor, Government College of Physical Education Curriculum, to handle the technical session. Please, sir, over to you.
Thank you, Silva. For the final time in Esperanza 2k20 International Conference on a glimpse into the future of sports and allied science sectors, jointly organized by Department of Physical Education, Mes Marampally, and CHMKM Government Arts and Science College, Thanur, in collaboration with Longford College, Ireland, and FA Innovations, UK. Final technical session of Esperanza 2k20, and we have two presenters today, and presenters kindly note, as said, we'll have 10 minutes for presentation and 5 minutes will be for discussion. And I also invite the kind attention of the panel of experts. Today's session will be chaired by SP ESS, Mahatma Gandhi University, Kottayam, Zakir Hussain, VP, Dr. KP Manoj, Director, Professor Leons Wilfred Bass, Dean, Department of Physical Education Pedagogy, LNIPE, Gwalior, Madhya Pradesh, Dr. Dino MR, Deputy Director, Department of Physical Education, Sanskrit Colony, and Dr. Jayarajan Devi, Director of Physical Education, Kerala University. We are moving on to and his Atul Mittal is the Assistant Professor, Department of Physical Education, Government Arts and Science College, University of Calicut. Over to you, Atul.
Hello.
Yes, Atul.
Am I audible?
Yes, you are.
Respected chairperson, delegates, and dear friends, a very good afternoon to you all. Myself, Dr. Atul Mittal, faculty in physical education at Government Arts and Science College, Calicut. At first, I would like to thank the organizers of Esperanza 2k20 for giving me an opportunity to present a paper in such a great platform. So I'm directly moving to my topic. I shall share the screen. Of water in that area. After rehydration, the belly comes back to its original shape. So the fact is that the only way to reduce fat from a specific region is to reduce the fat in general. The next myth, we become physically fit if we walk daily. Strength training is not required for common man. This is also another misconception in our society. When we talk about exercise, most of the people only do walking. They think that strength training is required only for elite sports persons. Actually, there is a phenomenon called fitness balance. In this, there are four main components which we have to address: endurance, strength, flexibility, and body composition. Endurance is the base of any type of physical fitness. Along with that, we need strength, flexibility, and body composition. By regular walking, we are only addressing endurance component. The other three components are neglected. So what we must do is we must do endurance training. Along with that, we can do a small type of on-board resistance training. And when we address endurance and strength training, naturally our body composition will improve. And doing some yoga asanas regularly will improve our flexibility also. So this is a model workout plan for a beginner. In this, I have given 3 endurance sessions in a week, that is Monday, Wednesday, and Friday, and 2 strength sessions a week, Tuesday and Thursday, and Saturdays for flexibility and Sunday rest. Here, as I said, endurance is the base of any type of physical fitness. That is why I have given more priority to endurance, and strength I have given 2 sessions, that too on alternative days. So that because strength, after each strength session, we need around 48 hours for the muscles to relax and recover. And along with this schedule, we must include or incorporate any type of games which are locally available, means locally played, like cricket, football, badminton, basketball, volleyball, etc. So why? Because these games bring in fun element to this fitness schedule. And only if there is fun element in it, then only we can do it throughout our lifespan. So the fact is that to achieve complete fitness, we must develop all components of health-related fitness in the required ratio. Then next myth, sleep is not at all important if we are physically active. This is some of the notion of some people. They think that we are doing physical activity daily, so we are not at all bothered about the quality of sleep one has to undergo. Actually, during the workout time, we work really hard, but we don't get the result of the workout during the workout time. Actually, we stress the muscle fibers and actually tear them. And it is only during the sleep that the growth hormone is released and it repairs and builds up muscles. So the reward for our hard work is we get our reward only when we undergo quality sleep. So adult requires around 7 to 8 hours of sleep during night. So the fact is that quality sleep is very important for getting the benefits of our workout. Next myth, for physically active person, yoga is not at all necessary. This is also some misconception in society. They think that yoga is only meant for women or old age people who are not physically viable. Actually, yoga is a practice for unifying body, mind, and spirit. It involves smooth movements in coordination with breath. It directly improves mental health and also physical health. And during this COVID-19 situation, asanas like pranayama is very, very important. It boosts the efficiency of our respiratory system. And in this COVID-19 situation, we should have a very good respiratory system. Then only we can defend or we can prevent COVID-19 diseases. And the fact is that practicing yoga along with exercise will improve our overall health. The next myth is fitness level achieved is permanent. This is some of the misconception of sports person, those who are retired. They say that they have worked really hard during their playing time. They have achieved many laurels and they have achieved a high level of fitness. So they need not worry about their fitness level in the post-retirement period. According to researchers in ACSM, American College of Sports Medicine, even 2 weeks of detraining decreases the endurance. And detraining for 8 months will result in loss of all fitness level attained. And loss of endurance occurs more rapidly than loss of strength. And compared to seasoned exercises, newer exercises will have this detraining effect more rapidly. So if you stop physical activity, fitness level will decrease. That is, fitness level is not a permanent phenomenon. It will decrease if you don't maintain it by doing regular physical activity. So I conclude by saying that we must inculcate physical activity or physical literacy with balanced diet and healthy lifestyle in every individual in the childhood itself, so that the child becomes a healthy citizen, and the collection of such healthy citizens will lead to a healthy nation with better immunity. Thank you.
Thank you, Atul. Over to the chair for further discussion. Hello.
Yeah, yeah. Good afternoon, all. Atul, it was a good presentation. Atul, I have a question for you. See, you were talking about the facts on fitness. I just have you were talking about the workout, various types of workouts for in a week. I'm just asking. There's one simple question. What should be the period of rest between each workouts?
ഡോക്ടർ അല്ല അവൻ എന്റെ ഫ്രണ്ട് ഷോമി ഞാൻ ഒരു മീറ്റിംഗിലാണ് കുറച്ച് കണ്ടു തരാം.
Hello.
Please, please mute.
Atul, was I audible?
Sir, can you once more? Can you ask?
Yeah, I was just asking. What should be the period of rest between each workout? Idle period of rest between each workout.
I think for strength training, there should be around 48 hours, as I mentioned in my presentation. For endurance and all, I think 1 day is enough. Means I am mentioning about normal people, those are not actively involved in sports. So they do a low to moderate intensity of exercise. So they need not have too much interval between each session.
Right. Then one more thing you were talking about in your presentation, you had said that overeating of carbohydrates leads to deposition of fat. See, but there are a lot of misconceptions among people that fat is usually deposited due to the high intake of fatty foods. There is another discussion going on now about keto diet.
Yes,
keto diet is basically a high protein diet. Will you recommend keto diet for a layman?
No, sir. No, sir. In keto diet, the process is completely different. The carbohydrate level is very low and the fat level is raised very high. So that may not suit everyone. So for normal people, taking balanced diet is very much okay for me.
Right. Thank you, Atul. It's over to the delegates who are over here. If you have any question, you can please ask Atul.
Yeah, Atul.
Sir.
Yeah, Atul. I'm a little late. Some technical issues happened. Anyhow, it was a good presentation. And I have the same question which Dr. Binu George asked. we know the concept of the it's the question of the hour is health. Everybody knows, especially in the COVID pandemic situation, we are facing the every World Health Organization and other medical sectors are telling physical fitness is the only medicine for the COVID-19, and immunity system of the body is the only way to overcome this COVID-19 certain extent. So my question, the continuous question from Dr. Binu George. See, many people are following the keto diet. And the physical education faculty is saying physical exercise is the best medicine to develop the physical fitness of the body. And some people are doing the keto diet. They are not doing any physical activity, but they are doing some dietical, the keto diet they are following. They are avoiding the carbohydrates. Totally, they are avoiding carbohydrates. But we need some carbohydrates for functioning of our body. So the same question I am asking: what is your opinion about the exercise for improving the physical fitness of the individual, or the keto diet for the development of the physical activity?
Sir, as I've seen, normal situation, normal people won't go for keto diet. Normal people will only follow this balanced diet with healthy lifestyle and exercise. But those who are having some very extreme fatness and all go for keto diet just to experiment. But I don't think there is any need for keto diet for a normal person. We can easily maintain our energy input and energy output balance by following balanced diet with healthy lifestyle and physical activity. I think so.
Yeah. Okay. What are the drawbacks of our curriculum system to introduce this physical activity in the curriculum or in the schools? So, what is any suggestion before you to put up? These are the way to develop the physical level of the students of schools level.
Yes, sir. The first and foremost step, I think we should appoint more qualified physical education teachers in the schools, because physical literacy has to be taught from the childhood itself. So they set the platform for an individual to develop, whether the individual develop to any profession, doctor, lawyer, or anything, or even sports person. Then he can tap the talent easily in the school itself and set the base for that particular individual to develop into a good personality. So the first thing is to appoint more physical education. Physical literacy should be taught in the school itself by appointing more teachers. At present, we have a very pathetic situation in schools. The clubbing of teachers is there, so that is affecting the health of school students. So that should be the first step. Then we can improve the curriculum and all, and thereby we can raise the standard of students in school itself.
Okay, good.
Thank you, sir.
Thank you. Any questions from
Dr. Mittal?
Sir.
Hello, can you hear me?
Yes, sir. Yes, sir.
Can you hear me?
Yes, sir. Yes, sir. Audible. Please carry on.
Okay. Atul, you have presented the paper very well in a good manner, and it is so informative during this COVID-19 pandemic. I have a question that do you have any ideal workouts for a layman to keep their body fitness? Do you have any suggestions?
For a normal, for normal people, we can start from means the principle should be simple to complex. So those who are not involved in sports or any physical activity, they can start by regular walking. They can start with 15 minutes. Then after adapting, they can move to 30 minutes, 45 minutes, and 1 hour. And with that, they can also include some resistance exercise using their own body, push-ups, sit-ups, crunches. So many things we can do inside in our house itself. So in that way, after adapting, they can move into more exercises with scientific background.
Okay, good.
Yes, sir.
There is a huge divide about functional fitness and cosmetic fitness. What's your take on it? Even what you said about spot reduction, it's not no more a myth. We can have it any other day. So what's your take on cosmetic fitness and functional fitness?
Cosmetic fitness means those who are.
I'm not asking about the meaning. How will you take you along?
Means I don't think cosmetic fitness is permanent solution. Means that is for a temporary phase, but the other one is functional. That is meant for our lifelong fitness and for the full lifespan. So I think functional fitness is more important than cosmetic fitness.
Thank you.
Okay, sir.
Wilfred, sir.
Dr. Atul, it was a very good presentation indeed. You have clarified almost all the doubts with regard to fitness by all the chairpersons of today. You have presented one thing with regard to a weekly schedule, that is a 2-day strength training and then 3-day endurance, 1-day flexibility and 1-day rest. So, is it specific to a particular age group, or is it specific to sedentary individuals? I don't think that this is suitable for a general population. I don't think so. It will be very specific to a particular age group or a particular population. Can you clarify on this matter, please?
Yes, sir. The thing what I mentioned is a general workout plan only. That is suitable for normal people, but for elderly people and all, that may not be suitable. So we have to manipulate the working schedule accordingly. We have to reduce the exercise intensity and all. Low intensity exercises we have to give regarding the functional fitness of elderly people. So this is just a model only, sir. I have not just to give an idea. That's all, and it is meant only for the health-related physical fitness components only, not for elite sports persons.
No, it is understood that it is only for a health-related physical, not for a light sports person, because the strength and endurance and flexibility, only 3 factors are there. So it's okay with your comments, and it would be good if you just go ahead and specify the age group which you specify that exercise.
Okay, okay.
Okay.
Okay, sir. Thank you.
If you specify the exercise, this is the exercise that I prescribe for such an age group, sedentary or those who are doing moderate exercises. Okay.
Okay, sir.
That's all. A very good presentation. Empirical paper presented by Atul Mittal is superb.
Thank you, sir.
Atul, there is one more question in the chat box.
Yeah.
Will high intensity exercise negatively affect the immunity?
Actually, I had a talk to an athletic coach. So I had discussion in this matter. So what they told is that when the elite sports person does an exercise or a particular routine with high intensity, after the finishing of the exercise, the first 2 hours he or she will be vulnerable in regarding to immunity. So that time the immunity is very low. After that, the immunity level may come up to its normal normality. So some researchers, the sample has been taken after the ending of the exercise within first 2 hours. So this research has shown that it doing high intensity exercise negatively affect the immunity. So that is why that research study result has come like that. The sample has been taken after the ending of the exercise within the first 2 hours. The sample has been taken. So it is always safe to do low to moderate exercise in this COVID-19 pandemic period.
Okay, thank you, Atul.
Thank you.
Sorry, any more questions?
I think I know we are. I think we can go on to the next.
Yeah.
Yes.
Binu sir, I can see Professor Wilfred's sir speaking. I think his microphone is muted.
No, it is on now. You can hear me?
It's fine. It is fine. Yeah.
Yeah. No, I think it's okay, good enough. It's a very, the topic itself is like a keto diet and all. There is lots of controversy going on. Even the 2016 laureate, Nobel laureate, he recommends keto diet, but there are certain ifs and buts that is to be taken care of. Otherwise, keto diet is one of the best diet to reduce the body weight. To be very frankly spoken, for last 2-3 months, first time in my life, I have reduced almost 15 kg, 15 to 16 kg. That's the greatest achievement I feel, but it's a Herculean task, very difficult task. But at the same time, we have to be very careful about certain things that you have to really read and keep yourself educated. Thank you very much from my side. Yeah, we can switch over to the next topic, next man.
The next presentation by Dr. Bindu, Professor, Department of Physical Education, Union Christian College, Iowa.
And her topic, exercise and osteoporosis. Over to you, Dr. Bindu.
Hello, Srinath. Am I audible?
Yeah, you are.
Can everyone see my screen?
Yes, of course.
It is clear now? Okay, a warm good afternoon to all. Respected organizers of Esperanza 2020, respected panel members of paper presentation, and dear participants. Myself, Dr. Bindu, Assistant Professor, Union Christian College, Alway. And my topic is exercise and osteoporosis. The idea here I want to convey is for the last 2 days listening to the expert talks from Professor Vincent, Professor Floney, Vinay sir, and the recent talk by Farah madam enlightened us with a wide scope of exercise science, especially as health workers. For this, we should equip ourselves with multi-skilled and competent to grab the new opportunity and have a lot to do to the community. I am sure that a day will come, doctors will prescribe exercise as a capsule for emerging lifestyle diseases. With this, I am moving to my topic, exercise and osteoporosis. I start with an article from a prestigious newspaper, Hindu, on New Delhi, March 23rd. Osteoporosis bringing capital to its knees, says doctor. India among the worst hit. Doctors highlight the importance of healthy diet and adequate exercise in keeping the disease at bay. Two silent epidemics, osteoporosis and vitamin D deficiency, are taking over the capital. It is estimated that 1 out of 3 women and 1 out of 8 men and in India suffer from osteoporosis, making the country the worst hit in the world. And according to Dr. K.K. Agarwal, it is important to exercise for at least 30 minutes thrice a week to strengthen the skeletal system and improve the bone density. From this, I hope you are very clear. Exercise is very important for maintaining the overall health of an individual and managing the lifestyle diseases. And coming to this is only a research paper, theory paper, and I had gone through many research reviews. Serious attention in osteoporosis in India started only in the year 1997. In 2003, a highly conservative estimate by a group of experts suggested that 26 million Indians suffer from osteoporosis, and this number is expected to reach 36 million by 2013. Due to an increase in the longevity of life in India, osteoporotic fracture are becoming major cause of morbidity and mortality, which is similar to the western part of the world. 1 out of 3 women between age 2 to 15 years in India suffers from osteoporosis. Indian women have an early age of onset of osteoporosis as compared to the western counterparts. And coming to what is osteoporosis, literally means porous bone, indicating low bone density, and the bones are very thin. Even with a small heat, there are chances of losing the bone or fracturing the bone. In early 1990s, a consensus meeting of World Health Organization defined osteoporosis as a systematic skeletal disorder characterized by low bone mass and a microarchitectural deterioration of bone tissue with subsequent increase in bone fragility and susceptibility to fracture. So coming to this, what is fragility fracture? Clinically, a fragility fracture may be defined as fracture that occurs as a result of minimal trauma. A minimum force is needed to break a bone. For example, bending forward, fall from standing height, hug, being turned in bed, etc. So, to get a clear picture about what is osteoporosis, I had put some of the images. Broken bones took away her independence. That's osteoporosis. When a sneeze can break your bone, when you sneeze, it can break your bones. What serious disease is this? Then again, she broke her hip after tripping over a carpet. She broke her hip after tripping over a carpet. That's osteoporosis. Broken bones took away his independence. That's osteoporosis. I hope the word osteoporosis and the lifestyle disease is familiar to you now. And now, moving to the common fracture sites of osteoporosis. Mainly, we can experience our common fracture sites are spine, in the hip, in the wrist. In the spine, it is usually undiagnosed unless pain or height loss. There will be a postural deformity which develops very slowly. We cannot identify in an early stage unless a severe pain or unless a protruding of your spinal region happens. So it is very, in a vertebra, when osteoporosis occurs in a spinal region, it is very serious. You should take care. And next is in the hip. Recovery from this is 50%, and the wrist, most common type of fracture is in women below 75 years. And these are the common sites where osteoporosis can happen to anyone. Then again coming to, and what are the causes? What are the causes which leads to osteoporosis in an individual? Our bones are a living tissue and constantly changing from the moment of birth until young adulthood. Bones are developing and strengthening. The major causes of osteoporosis are the following. First and the foremost thing, you had heard the paper from Atul speaking about the nutrition, what type of nutrition you should consume to maintain a fitness, and the diet plays an important role in maintaining or preventing osteoporosis, a lifestyle disease. Diet, you should consume a very balanced diet with adequate nutrients needed. And next important is exercise. You should exercise. What type of exercise is needed? That will be coming in the another slides and all. You should exercise regularly. Regularly means according to your level of fitness and according to the fitness needed by you, you should train systematically to maintain your overall health of the individual. And again, there are chances low sex hormone. When the woman is at menopause, their hormone estrogen secretion is very less, and it can lead to osteoporosis. Then the medical conditions, like when you are having certain injury or certain diseases like cancer, breast cancer, then again bone cancer, it can also lead to osteoporosis. Then medication, what are the medicines you are taking? Some type of steroids, it can also affect the bone formation. Then again the lifestyle, the smoking and alcohol. Then these are the main causes which can lead to osteoporosis in an individual. Then the major, this is the most important part as a physical education teacher I have to deal with. Exercise effect on bone health and osteoporosis. You had studied a lot of studies related to exercise effect on various systems of the body. Again, in the skeletal system, what happens? It helps in the formation of new bone cells. What is the new bone cell mean? There are two cells which helps in the formation of bone, osteoclast and osteoblast. When you exercise, these cells will function efficiently and which helps in the formation of new bone. Exercise works on bones much like it works on muscles. It makes them stronger. Exercise is important for building strong bones when we are younger, and it is essential for maintaining bone strength when we are older. Because bone is a living tissue, it changes over time in response to the forces placed upon it. When you exercise regularly, your bone adapts by building more bone and becoming denser. Inactivity causes loss of bone. Then the first important, when you exercise, what will happen to your body? The mechanical loading, the force exerted on it, the force is exerted on the different muscles, skeletal system, digestive system, excretory system. And what will happen when you exercise continuously and systematically for a period of time? Almost all the system will be affected, and it helps in the functioning of the almost all the system. Naturally, it helps in building stronger bones also. So, as the body ages, bone density naturally decreases. In severe cases, it leads to osteoporosis, resulting in increased fracture and fall from weakness. So, what the mechanical loads be exerted when you exercise, which helps in the bone strength, increase the bone density. It helps in increasing the bone density. Exercise helps to mitigate the process of bone degeneration and causes remodeling of the bone. When you here you can ask a question where when you do exercise more means overloading can affect when high impact exercise. You should always do exercise according to your fitness level and according to your need. When you exercise more, that you may be seen that the gymnast at young age is overloaded with workout, so stunted growth retarded growth, and it happens. So while giving exercise to your bone, you should take special care to maintain it will not affect the growth of an individual. The next one is the exercise promote bone formation. The first and the main important point, exercise promote bone formation. There is a bone is a very vascular. There is a continuous supply of blood to the bones. So when you exercise, the need of your blood supply will increase, which helps in the multiplication of blood capillaries. Blood capillaries in the bones will start multiplying. That is known as angiogenesis. So when you exercise, it helps in the formation of bone formation, helps in new bone formation, mechanical loads including compression, strain, fluid shear are the stimuli that play essential role in osteoblasts, differentiation and mineralization. So in our bodies, I earlier told, in our body there are two groups of special cells that perform the work of a maintenance group. Osteoclasts excavate any area damaged or weakened bone. Then osteoblasts fill in the surfaces with material that hardens to form new bone. So by this it is important you exercise regularly to maintain the bone formation, to increase the bone density, and to maintain the overall health of an individual. Then it helps in improve balance and coordination. It's an important point that you have to exercise regularly for the coordinated movement. We all are in a movement. Without moving, we cannot progress in life. So exercise science for movement education is very important in European countries. When you move, there should be a coordinated movement. You had seen in our college, a lot of students coming, their postural deformities, the walking coordination. When I ask to run 50 meters, they will fall down. So there is no motor coordination at all. So there are chances of falling down. So improve balance. Exercise is very important to improve balance coordination, and it helps in preventing osteoporosis in the later stages. So then coming to exercise regulates and promote the production of hormone. The hormone like estrogen is very important in helping forming the bone formation. So in women, due to the lack of menopause period, there are chances of getting osteoporosis. There is a lack of estrogen secretion in their body. So when you exercise, this helps to stimulate and regulate the particular hormone related to it, regulate the functioning of the hormones, and it helps in increasing the secretion. So there are a lot of studies related to that, menopause and osteoporosis, early menopause and osteoporosis. Then other benefits are there will be a regular exercise helps in overall physical fitness of an individual, reduce pain, reduce risk of bone fracture caused by fall. Then again, overall immunity, it helps in the immunity level of an individual. Then again, Exercise recommendation to prevent osteoporosis. What are the exercises to be recommended when you to prevent osteoporosis? It definitely say osteoporosis develop in a later stages. And what are the exercise recommendation to prevent? There are chances of getting early osteoporosis also. So what are the recommendation to prevent osteoporosis? Physical activity. I told already the causes. The first and important cause is exercise with adequate nutrients. Physical activity, particularly weight-bearing exercise, is thought to provide mechanical stimuli. Weight-bearing, there is a misconception that when you do a lot of gym workout or weight-bearing exercises, women having the misconception, my femininity may boast. So it is a very misconception that I told my students that don't take it as don't take that into consideration. There are no chances of multiplying muscle fibers. It is genetically determined. So when you exercise, there is no chances of getting a muscle to be bulged like masculine. You should do sort of exercise which will not beyond. When you go beyond the capacity, or when you take additional drugs, steroids, there are chances of masculinity, it will have femininity will go. So for a normal individual, low impact weight training, never, femininity will never goes. Please, as a physical education teachers of various institutions, please clarify this doubt to your students. A number of systematic reviews and meta-analysis have suggested that exercise program combining low impact weight bearing exercise and high intensity training maintain bone density in men and postmenopausal women. And here comes exercise recommendation to prevent osteoporosis. I have already taught this one. And next one is bone strengthening program. What are the bone strengthening program? I already told weight bearing exercise is the main part of strengthening the bone. This is only a module only. You can change this according to your situation. Include weekly twice a moderate or a low impact weight bearing exercise to maintain the bone health. Exercise type, weight bearing, walking, climbing, playing twice a week. So these all are low impact. Without weight also we can do a lot of exercise for strengthening the bones. Muscle strengthening exercise. Again, you have to balance exercises. Balancing movement is also very essential. There are chances of falling down. Then the flexibility exercise. So combination of this according to your need, you can combine, you find an exercise therapist, a doctor, and build an exercise program appropriate for you. Then next one, special exercise consideration. What are the special exercise consideration one should follow? A person with osteoporosis has weakened bone that are prone to fracturing. They should avoid activities that loaded form of flexion. In the spinal area, you should not do more flexion exercises which have increased risk of falling, sudden and forceful movement, exercise which require a forceful twisting motion. All this exercise should be taken very careful when you are doing exercise to an osteoporosis patient or an osteoporosis. There are chances, I too have chances of getting osteoporosis. So don't feel I won't get this disease. There are chances. So when you are aged, don't go for high impact weight training suddenly. Start from low impact, and consideration like this should be taken carefully. And what are the therapeutic goals should be targeted for individual with osteoporosis? I had given a preventive methods, and here coming to what therapeutic goals should be targeted for individuals with osteoporosis. Prevent fracture via, there are chances of getting fracture, the fracture that come through fall, prevent falling. Safe movement, you can take the help of anything, any material from outside for the safe movement. And prevention of further bone loss. Here is the importance come, prevention of further bone. You should take care of your bone, do exercise and diet. With both of this, you can maintain or prevent. These are the therapeutic goals should be inculcated in your schedule. And what are the recommended exercise when there are a lot of osteoporotics can be mild to severe. So according to that, you should always take an advice from the doctor, and the recommended exercise, engage in multi-component exercise program. First, build a multi-exercise program, including resistance training, combination with balance, and do not engage in more aerobic. More of aerobic training is not needed for these people, and they can combine yoga. If they need cardiovascular fitness, there are a lot of breathing exercise. You can take it and for building the cardiorespiratory fitness. And what can health and exercise professional, here is important, what can health and exercise professional do? Design exercise program that will challenge and benefits the bones and prevent fall. It is very a multi-task. You should be very competitive in handling this type of people, and you should build an exercise program suited to prevent this disease. Then to conclude, I'm going to the concluding part. When people lose weight, they also lose bone. Low body weight at any age is associated with a great risk of bone problem and fracture. And there are my students who say my body weight is gone down and it is very lean. Am I healthy? Don't think like that. When your body weight is going down, when the bone health, it will affect the bone health. Very low body weight has increased consequences for women. Very low body weight has an increased consequences for women. I had conducted a study previous 2-3 years before, taking the quality of physical fitness among the UC college students, and majority of the students are having low body weight, again in the women's section. And it is when we correlated with economic status, those who are having low income group, they comes under low body weight. So there are, out of 500 students, there are 200 students coming under low body weight. There are chances of osteoporosis and in the future, and there are a lot of chances of lifestyle diseases. Although exercise has shown to have clear bone building effects in children and adolescents and bone preserving effect in adults, is just one element of a total program. Don't think that exercise is enough to prevent almost all the diseases. To combine with, you have to take a lot of nutrients, you should modify your lifestyle. All this is an overall, you have to take, if you want to take care of your health and overall fitness, you have to take care of almost all the fitness needed to overall fitness. Overall fitness include the lifestyle modification, the way that you take the diet, and again the exercise. This is all should be merged in an equal quantity. Then only you can build a healthy citizen. So understanding your individual risk of osteoporosis, such as genetic factors and family history, is very essential. A balanced, calcium-rich, adequate vitamin D and healthy lifestyle, avoiding excessive alcohol and nicotine, are also key ingredients for lifelong bone health. Hope you all got the point. So keep exercising to bring your bone strong and healthy. Thank you. If you have any doubts, you can clear.
Thank you, Dr. Bindu.
Thank you, Srinath.
I request the chair to kindly take up the discussion.
Can I start?
Yes, sir, please.
Or Dr. Binu, I think Binu sir has started, I suppose. Can I start, sir? His microphone.
Binu, sir, please unmute. Binu, sir, please unmute.
Binu, sir. Yes, sir. Binu, sir. Well, Dr. Bindu, that was an excellent presentation. Well, we can see we have our extremes widened. A girl starts menstruating at the tender age of 10, and most of my contemporaries who are into their mid-40s, they have started their experiencing their menopause. So they have another 20 to 25 years more to live as per the expectancy. So how do you see being estrogen a villain in reducing the bone mineral density and osteoporosis, leading to osteoporosis? How do you see a parallel of HRT, hormone replacement therapy, therapy along with exercise as a preventive measure for tackling osteoporosis?
Sir, I told you that the main causes of osteoporosis is there are a lot of factors which lead to osteoporosis. First important thing is diet. When you consume a hormone-rich food, you are consuming that. Then you may be already knowing that the small kids needs chicken every day. The hormone the content of the hormone is very high. All this lead to, then again there are chances climatic condition which can lead to early menstruation in the kids. So all these factors, then the taking of steroids by the parents, almost all the lifestyle had changed. In my parents, when we go to the early ages, there is no such diseases have been seen. So totally, when we are taking the lot of changes in the lifestyle, climatic, we have to take into consideration almost all the factors when you have to design or increase the estrogen secretion. These are all methods, side by side method, how to enhance the physical performance and how to enhance the hormone replacement. So combined exercise with then again the quality of life. The quality of life has an important factor, and the lifestyle modification has an important factor in estrogen secretion. Then the estrogen secretion, there are genetic factors, or genetic factors we cannot go through it because genetically that you have to take medication. So you have to go through almost all the overall health condition and overall factors which affect the individual health, and then you can modify the estrogen effect in our body. Am I clear, Divu sir?
Yes. Thank you. That's it.
Any more questions?
Srinath?
Yes, Bindu sir.
Yeah, Dr. Bindu, you had presented your academic paper excellently. I have a couple of questions before you. As you rightly pointed out in your presentation, that the deficiency of vitamin D plays a vital role for the cause of osteoporosis.
Yes.
How does vitamin D lead to deficiency of vitamin D lead to osteoporosis?
Sir,
Second question. I have a second question. I'll complete my questions, and I hope you can answer it at a time. And whatever exercise you recommend for increasing the bone density, and can we reverse osteoporosis through exercise? Dr. Bindu.
Sir, I will answer your second question. Your question is, sir, one more time, sir.
What type of exercise will you recommend?
Sir, we have to do low impact weight training exercise. Low impact weight bearing exercise is very essential to maintain the bone health. Always, everyone used to go for a walk. That enhance the cardiorespiratory fitness. So weekly twice, you go for a low impact weight training, and just you have to increase low impact to high impact, and according to the what type of fitness you need. For an optimum fitness, low impact is enough. Low impact weight bearing exercise is enough. Then again, coming to vitamin D, the vitamin D deficiency can lead to, vitamin D is very essential nutrient for the bone growth. So when you have to consume the needed vitamin D deficiency means it is needed in a very low quantity. And nowadays everybody is sitting in the room and doing almost, now we are not going out in the AC room. You are sitting and within a one switch, the whole world is in front of us. So the deficiency of vitamin D, you don't think vitamin D can be will be getting from the sunlight itself. There is a particular time when we go out and sit in the afternoon sections and all, there is no chance of getting vitamin D. Then again, if vitamin D, when you sit in the sunlight or when we consume vitamin D, there are no chances. I am consuming vitamin D daily and my bone health is not improving. Our body has the capacity to utilize the vitamin D. Then only the bone health can be improved. So there are a lot of factors which can lead to the when we take vitamin D also, our body should have the capacity to generate the needed nutrient vitamin D from that energy. So I hope you will be clear from.
Yes, what about my last question? Can we reverse osteoporosis
Yes, sure. Yes, this is a lifestyle disease. Definitely, osteoporosis can be reversed when you do an regular systematic exercise program with almost all the causes I had defined. A lot of 6-5 factors which lead to osteoporosis. When you are following all these causes and scheduling the program in a right sense, overall lifestyle, definitely this osteoporosis can be reversed. This is not a disease we cannot cure at all. This can be prevented in future. We, the physical education faculty, should go around the community. I always think that we are doing what we are doing. You should stop competitive sport for a while and start get down to the community. Get down to the community means the students of your institution. Get down, stop your competitive sport, and overall take care of their fitness.
Okay, thank you, Dr. Bindu.
Okay.
So, Dr. Bindu.
Okay, sir.
So nice presentation regarding the osteoporosis. And let
sir.
me want to clarify one thing. One of my friends, he visited a doctor, and he was advising him that don't do any sort of exercise, and he was having the osteoporosis. And do you agree with this statement and how he can reverse
No,
it?
sir. It is a misconception. It is a misconception. Then nowadays studies are.
But the doctor is the person who is giving advice that don't do any sort of exercise that will harm your bones and joints, and you do not do any exercise. Do you agree with that?
No, I won't agree with that. It's a misconception. I am doing a Coursera course in an international university. It said it's a myth. You should do exercise. When you are having osteoporosis, you also should exercise therapy should be combined with exercise therapies. Follow a schedule. You should always take support from it. There is a myth earlier. You don't do exercise, your bone will break when osteoporosis happens. It is a myth. You should do exercise. That is, you should take support from the external expertise.
Okay, very good presentation, Bindu, sir.
Thank you, sir.
Hello.
Hi, sir.
Hello.
Yes, sir.
Yeah, Dr. Bindu, I am really impressed. The confidence you have shown and you have gone through this topic. It's a very, very, disturbing topic these days. People, majority of ladies after their middle age, they are the sufferers of this so-called osteoporosis. And I'm happy that you have spoken that the only best and the best remedy for this is weight-bearing exercise. You need not go for weightlifting or powerlifting or such activities. You are very well said. Yes, moderate weight training exercise, maybe with an external weight or maybe with your own body weight. That is the only remedy to get rid of. And even I have read somewhere, excessive intake of calcium, it leads into further complications, many other complications. So it is not required, and it is not going to do any. People used to tell you should have taken lots of milk and all. Okay, fine, but after that particular age, like Dr. Dinu was talking, after certain age, it is not going to help you much. The intake of what you call milk or calcium and such products. After an age, it is not going to work out. Only remedy is, like you said, the weight-bearing exercises. That's why people used to tell most of the sports advanced countries and advanced countries, most of the gym are being occupied by the middle-aged ladies, and they will be doing all kinds of weight training exercise. So I'm happy that you have, in the beginning, you are not touching those points like some of the aspects. But I am happy towards the end. You have very clearly said, yes, it is because of this calcium deficiency. Also, you are not stressing on in the beginning, but you have stressed that aspect as well as the what you call weight-bearing exercise. I'm very happy to hear you have done it very well. Thank you.
Thank you, sir. Thank you, sir.
Yeah.
Thank you so much, Dr. Bindu. Thank you, Chair.
Thank you.
Srinath, you may please ask Manoj sir. He was unmuting his mic in between.
Yeah, okay. Manoj sir, you there?
Hello.
Yes, Manoj sir.
Hello. Can you hear, Srinath?
Yes, sir. It is audible. Please carry on. Yeah.
This is found to be more prevalent among women.
Yeah.
Okay.
Yes.
So, has it to do something with regard to the hormones and how it can be delayed among women? Because today morning itself, I was asked by a friend of mine how to overcome this. He has called from Bangalore and asked me how to cope up with this, and it is they have a misconception that this is an hereditary problem, because my friend's wife is having osteoporosis and she's telling that her mother was also having osteoporosis. It's a hereditary problem. Is it hereditary, and how it can be delayed? Is there some sources of food by which we can delay this osteoporosis or avoid at all by the end of the life?
So first I'm coming to it is not a genetic factors. The readings from the research reviews I had taken, and I had gone through various article and from the expert talks from the doctors, osteoporosis is not at all a genetic factor. There are other born diseases which may lead to, there are other born diseases which happen to an individual which is genetically acquired, which can lead to osteoporosis. So we have to find out the exact fact which lead to the osteoporosis. So then again, there are early onset of puberty. In a study in Malabar area, in the northern Malabar area, there are a lot of women which are prone to early menopause, and there are osteoporosis. We are not this is not taken into a consideration by the government at all. So nowadays the studies are coming. I had read one or two studies from Kerala side, the northern Malabar side. There are a lot of chances of getting that may be the problem due to early puberty and early marriage, and not consuming sufficient amount of nutrients. So almost all these factors can lead to this lifestyle disease. Definitely, this disease can be removed from our society if proper care is taken from the early age itself. Quality lifestyle. Hope sir, Manoj sir, you may be clear.
You have mentioned about early puberty and all. Has it to do some relation with
Has it? Yes, it had a lot to do with the osteoporosis. Estrogen secretion at a very early age. It lacked the property. It lacked the property to in the later stages. There are chances use and overuse. So there are chances of getting. But when you adequately consume almost all the nutrients and the quality lifestyle, this can be delayed.
Can it be avoided at all?
Which one? Osteoporosis.
Osteoporosis, if it is.
Yes, sir, it can be avoided. It can be avoided. Our society should think. Provided physical culture should develop in our society. Definitely, as a physical, you have what to do to the society, sir, as directors of physical education and academician. So, as
very good presentation. In fact, it is a very good presentation. Dr. Farah also mentioned about the difficulties during pregnancy and all. These two factors, these two areas, and one more area is with regard to the cardiology and cardiac surgery and all. We physical educationals should indulge in such matters and be expertise in such matters so as to advise those medical experts to do exercises which are beneficial with regard to this
healthy nation,
healthy lifestyle. That is cardiology. One is cardiology in the sense there are very, very specific exercises by which we can advise cardiologists and cardiac surgeons to the effect that these are very effective, but we should be knowing it to such an extent that it should not exceed the limit. If it exceeds the limit, that patient will die.
Yes.
That is one area. Another is osteoporosis and rehabilitation of this rehabilitation with regard to bone injuries or bone fracture or dislocations and all. One factor Dr. Farah has mentioned is with regard to pregnancy also. We can involve ourselves a lot in it. So with these three areas, I think we can come up like anything. I expect a majority of the professionals in physical education to come up with much knowledge in exercise physiology, anatomy, physiology, exercise physiology, biomechanics, and kinesiology, so that this profession is grown. A nice presentation indeed.
Thank you, sir.
Thank you to the compeer, Mr. Srinath.
Yes, thank you, sir. I request
Dr. Bindu.
Professor. Yeah, Sakir sir, please.
Yeah, Dr. Bindu, it was a nice presentation. You are presented very effectively and very simple. You are presented. And my question or my doubt, it's a fact that exercise will improve the all the areas of our physical conditions, especially in the bone density or osteoporosis, whatever it may be. But my question is here. My question is, what is the role of the muscles? So we are aware that the muscles is playing a major role in exercise, especially in osteoporosis. The role of the muscle, how it will contribute to overcome the osteoporosis in a certain extent.
Sir, movement is possible only through the coordinated movement of muscular system and skeletal system. If you do exercise for the skeletal system, automatically it affects the muscular system also. So coordinated movement is possible only through combination of, when you do exercise, when you do any sort of exercise, it will affect almost all the systems of the body. There are chances, so a low impact exercise can affect. The amount should be prescribed by us or the doctors. So definitely your question is where the muscular system, when you exercise for your skeletal system, movement is only possible through the coordinated movement of muscles and skeletal system in the body. Definitely when you exercise for the skeletal system, it automatically develops the muscular system. So are you clear, sir?
Yeah. So muscle is an important role, playing an important role to overcome this disease. Yeah.
Well, Dr. Bindu, there is a clarification from Dr. Biju Lona.
Yes, sir.
His clarification is that will exercise increase the level of estrogen and testosterone?
Definitely. Exercise has shown estrogen level of use. There are a lot of studies related to athletes and non-athletes. The estrogen level and testosterone level of an athlete and non-athlete. Definitely it will affect the secretion of hormones of estrogen and this one.
Okay, thank you.
Yes, sir. I request Professor Wilfred sir to sum up today's technical session.
Thank you, Srinath and Hanifa sir and the organizers of giving me such a wonderful opportunity. Thank you very much.
Thank you, Mrs.
Hello.
Yes, sir. Please.
All of you can hear me?
Yes, it is clearly audible.
Yeah, last this, including today, these 3 days, it has, I very seldom used to participate some of the activities. I know Dr. Sakir Hussain, they were organizing. I could listen our Victor Manila's program and some of the programs that recently you had. I'm forgetting who was that. I could listen here and there, but this I take the full credit, and I have taken the full credit of attending all the 3 days, right from 12:15. I was there because I was told, yeah, please do come. So I thought, and I really have taken the maximum advantage of this. I, from my core of my heart, would like to congratulate the entire group of people, these two colleges and the Vinay's effort from UK. And I thoroughly, to be very frankly spoken, I have thoroughly enjoyed this session, all the 3 days. And most of the students or the delegates, they have presented very well. Even Dr. Bindu is a very hot subject. I have already spoken about. It was very well spoken. It was a very good presentation. And right from the first man, that foreigner, I am forgetting his name, the boy from the football coach from UK, he also presented well. And I was really touched by the, I don't know what was his name, who has come with that SpeedX, some equipment.
Aju. Yeah.
What that?
Aju TG.
Aju. Only thing is, I just couldn't listen because I was out of connection. I couldn't hear anything. But that's a, then I finally
Sir, your microphone got muted, sir. Wilfred, sir, please unmute. Sir, can you hear me? Wilfred, sir. Hello.
Hello, Wilfred, sir. Can you please unmute?
Srinath, give him a buzz over cell phone.
Yeah, okay.
Wilfred, sir.
No, I'm calling him.
Okay.
I'm not getting him, but try from your side. Then, do you have any other number?
So will you please take over yourself or Dr. Binu or Dr. Sakir? Must be some connectivity issues. If you could complete, that would be fine.
I think there's a technical issue with Wilfred,
it must
sir.
be.
Yeah.
Okay, I will just go through. I will just mention
Yes,
about
yes,
the four
yes, Manoj, sir.
papers.
Yes, Manoj, sir.
Yes, sir, please.
There were 8 presenters who have presented papers over here. 4 were experimental papers and related with research work they have done, and 4 were empirical papers. The last 2 were empirical papers, and the other one one was talent identification with regard to football by Mr. Marjan. And one more empirical paper was that is management of diet and nutrition for in sprinters. The 4 experimental or research papers, all were good, in fact, but the presentations do differ. I don't want to comment on the pros and cons and the best and all over here. In fact, the last two were very good, exceptionally good. Although they were empirical papers, so one was related to fitness and the other one with the osteoporosis. Two very important factors or important areas by which the physical education should indulge in, so that we come out of our shell and be among others, promoting ourselves among the masses or among the masses, in the sense among the people, general population. So I was asked to judge. I don't want to comment on any of the papers over here. In fact, all the papers were good, 4 empirical, 4 research papers. And let the judges also, other judges decide upon which is the one to be given the best paper. That's all.
Yes, sir. Thank you, sir. Selva, can you carry on? Selva, you there?
Okay, sir. Thank you so much. Thank you, Srinath, sir, and thank you, panel of experts. And also thank you, presenters. Those presentations were amazing. That was really great. So the best paper will be announced soon by the panel of experts. And in the meantime, let's watch a small video made by Mr. Joel Nelson. Enjoy the video. Warm greetings from Esperanza. Let your hope shape the future.
This is the first time an institution jointly organizing an international conference with paper presentations.
The fact is that sport brought them together for that short period.
You are the people who will make the change. Don't wait for anyone.
You can see whether they're challenging enough, and you can see whether they get on well together, as in a team.
Technology will deliver seamless and integrated results that will enhance the sports experience.
As we all know that whenever we are talking about the sports, so we are going with some sports movement and some physical movements.
Hoping that Esperanza 2020 would be indeed a hope that would be cherished throughout the pages of history of both the institutions.
I am honored and I am humbled to introduce Mr. Vinay. He is a veterinary wellness coach with an enviable client list that includes elite sports professionals, musicians, business tycoons, Middle Eastern royalty, and world leaders.
Nothing different. We all have a journey, but only thing we need to look back to that journey to create something.
Demanding extra training for incapacity program to improve executive functions of the children with attention deficit hyperactivity disorder.
Perceived value based on perceived rating and self. The perceived rating player assessed predicting his own score out of 10.
Aerobic exercise leads to changes in the protein level of urine. A small amount is normal, but a large amount of protein in urine may indicate kidney disease.
Only thing is that the reliability of the tests have to be a certain.
Measure the accuracy of the fastest.
What a title. Hope. The meaning of the title is hope.
So what I would request everybody, see, sky is the limit.
You will have 10 minutes for presentation and 5 minutes will be for discussion.
Today is absolutely a very special day for international conference.
Warm greetings from Esperanza. Let your hope shape the future.
This is the first time an institution jointly organizing an international conference with paper presentations.
The fact is that sport brought them together for that short period.
You are the people who will make the change. Don't wait for anyone.
You can see whether they're challenging enough, and you can see whether they get on well together, as in a team.
Technology will deliver seamless and integrated results that will enhance the sports experience.
As we all know that whenever we are talking about the sports, so we are going with some sports movement and some physical movements.
Hoping that Esperanza 2020 would be indeed a hope that would be cherished throughout the pages of history of both the institutions.
I am honored and I am humbled to introduce Mr. Vinay. He is a veterinary wellness coach with an enviable client list that includes elite sports professionals, musicians, business tycoons, Middle Eastern royalty, and world leaders.
Nothing different. We all have a journey, but only thing we need to look back to that journey to create something.
Demanding extra training for incapacity program to improve executive functions of the children with attention deficit hyperactivity disorder.
Perceived value based on perceived rating and self. The perceived rating player assessed predicting his own score out of 10.
Aerobic exercise leads to changes in the protein level of urine. A small amount is normal, but a large amount of protein in urine may indicate kidney disease.
Only thing is that the reliability of the tests have to be ascertained.
Measure the accuracy of the fast exit.
What a title. Hope. The meaning of the title is hope.
So what I would request everybody, see, sky is the limit.
You will have 10 minutes for presentation and 5 minutes will be for discussion.
Today is absolutely a very special day for international conference.
Warm greetings from Esperanza. Let your hope shape the future.
This is the first time an institution jointly organizing an international conference with paper presentations.
The fact is that sport brought them together for that short period.
You are the people who will make the change. Don't wait for anyone.
You can see whether they are challenging enough, and you can see whether they get on well together, as in a team.
Technology will deliver seamless and integrated results that will enhance the sports experience.
As we all know that whenever we are talking about the sports, so we are going with some sports movement and some physical movements.
Hoping that Esperanza 2020 would be indeed a hope that would be cherished throughout the pages of history of both the institutions.
I am honored and I am humbled to introduce Mr. Vinay. He is a veteran wellness coach with an enviable client list that includes elite sports professionals, musicians, business tycoons, Middle Eastern royalty, and world leaders.
Nothing different. We all have a journey, but only thing we need to look back to that journey to create something.
Demanding extra training for impactful fitness program to improve executive functions of the children with attention deficit hyperactivity disorder.
Perceived value based on perceived rating and self. The perceived rating player assessed predicting his own score out of 10.
Aerobic exercise leads changes in the protein level of urine. A small amount is normal, but a large amount of protein in urine may indicate kidney disease.
Only thing is that the reliability of the tests have to be ascertained.
Measure the accuracy of the fast exit.
What a title. Hope. The meaning of the title is hope.
So what I would request everybody, see, sky is the limit.
You will have 10 minutes for presentation and 5 minutes will be for discussion.
Today is absolutely a very special day for international conference.
Warm greetings from Esperanza. Let your hope shape the future.
This is the first time an institution jointly organizing an international conference with paper presentations.
The fact is that sport brought them together for that short period.
You are the people who will make the change. Don't wait for anyone.
You can see whether they are challenging enough, and you can see whether they get on well together, as in a team.
Technology will deliver seamless and integrated results that will enhance the sports experience.
As we all know that whenever we are talking about the sports, so we are going with some sports movement and some physical movements.
Hoping that Esperanza 2020 would be indeed a hope that would be cherished throughout the pages of history of both the institutions.
I am honored and I am humbled to introduce Mr. Vinay. He is a veteran wellness coach with an enviable client list that includes elite sports professionals, musicians, business tycoons, Middle Eastern royalty, and world leaders.
Nothing different. We all have a journey, but only thing we need to look back to that journey to create something.
actually demanding extra training for interactive program to improve executive functions of the children with attention deficit hyperactivity disorder.
Perceived value based on perceived rating and self. The perceived rating player assessed, predicting his own score out of 10.
Aerobic exercise leads to changes in the protein level of urine. A small amount is normal, but a large amount of protein in urine may indicate kidney disease.
Only thing is that the reliability of the tests have to be certain.
Measure the accuracy of the fast.
Okay, so the feedback form will be given in the chat box very soon. So please take your time to fill that form so that you can get the certificate. So the honorable chairs have decided the best paper award, and to announce the best paper award, I would like to invite Dr. Binu George-Burgess, the Director of Physical Education from NG University, to present the award. Over to you, sir.
Am I audible? Yeah. Yeah, thank you very much. It was indeed a great pleasure for me to be associated with this international seminar, ESPERANZA 2020. And all the technical sessions as well, the papers presented in the seminar was excellent. On behalf of all, we just had a discussion with the other chairmen of various technical sessions. And we have come to a conclusion that the best paper for this ESPERANZA 2020 was of talent identification by Mr. Marjan Anastaski from UK.
Thank you, Binu sir, and congratulations to Mr. Marian Anastasia for being the best paper presenter of the event. So now we are moving on to the vote of thanks, and for that I invite the person who put forward all of his effort for the success of this program, the organizing secretary of Esperanza, Mr. Hanifa KG, Assistant Professor, Department of Physical Education, MES College, Marampally, to propose a vote of thanks. Please, sir.
Thank you, Selva. It's been a great pleasure being with you all for the last 3 days. Finally, it's time to end the International Conference Esperanza. There is a short story behind Esperanza. Me and my friend, best friend, Binulal, we studied together at Pondicherry University. At that time, we had a student organization called Anugraha Student Society. And it was the concept of Father Dominic, who is a priest and who was teaching ethics at Pondicherry University. And we thought to have a cultural fest for the entire students community at Pondicherry University. And it was the Father Dominic gave a name for that cultural event, Esperanza. And that was happened in 2002. And one more thing I want to say, that the icon of the event, this conference, Mr. Vinay Menon, who introduced Father Dominic to me. And we again thought to have a conference like this and we searched for a name. And we did not get any name as beautiful as Esperanza. Thank you, Father Dominic, for giving us a beautiful name, Esperanza. Ladies and gentlemen, this conference is a joint venture organized by Department of Physical Education, MES College, Marampally, and CHMKM Government Arts and Science College, Thanur, in collaboration with Longford College, Ireland, and FA Innovations, UK. As you all know, the organization of such events are generally the result of close cooperation among several institutions and individuals. It is my great pleasure to express, on behalf of the organizers and on my own behalf, a deep appreciation for the support and encouragement provided by such individuals and institutions. At the outset, it's my pleasure and privilege to thank Professor Vincent English, who inaugurated Esperanza 2020. On behalf of organizing committee, I thank you, sir. Icon of the conference, Mr. Vinay Menon and Professor Flomi Menon gave me guidance, support to conduct this conference in an organized way. Thank you, Mr. Vinay and Flomi Menon, for enriching this event with your valuable experiences. I express my gratitude to Dr. Farah Said. It was very informative session. On behalf of Esperanza, I thank you for sharing your thoughts in this conference. It was the technical committee reviewed all research papers and selected best paper in the conference. On behalf of the organizing committee Esperanza, our heartfelt thanks to the professors and directors of physical education, Dr. K.P. Manoj sir, Kannur University, Professor Leons Wilfred was, LNIP Gwalior, Madhya Pradesh, Dr. Binu George Varghese, Mahatma Gandhi University, Kottayam, Dr. Zakir Hussain VP, University of Calicut, Dr. Dinu MR, Sri Shankaracharya University of Sanskrit, Kaladi, Dr. Jayarajan David D. Kerala University. Thank you, sir, for your valuable time and support. Let me thank the chief patron of Esperanza, MES President, Dr. Faisal Ghafoor, patrons of the organizing committee and college managing committee members, Chairman Mr. M.A. Mohammed sir, Secretary Dr. Abul Hassan sir, Treasurer Mr. Pareed sir, and organizing President Mr. T.M. Zakir Hussain for their support and encouragement. I must say that the incredible leadership, proper advice, and the freedom in decision making provided to us by the principal of Marampally MES College, Dr. Ajim P. Muhammad, and Dr. Abdul Ghafoor, Principal Government Arts and Science College, Thanur, and Vice Principal Dr. Mansoor Ali PP have been indispensable for me to work on this conference. Thank you, sirs. The organizing committee congratulate all those who presented papers in this conference, and they made this conference a rich and informative. On behalf of Esperanza, I thank everyone for being a part of this event. And also, I congratulate Marian, the football coach, for securing the Best Paper Award. Congratulations. Success of this conference is the result of teamwork, especially the committed and hardworking team members. Without this team, I would have done very little. I sincerely thank the coordinator Sindhupi, joint coordinator Srinathas, Sujit Babu, Vivas Salim, who prepared the logo for this conference, and Ms. Arifa P. Thank you, dear colleagues. My special thanks to Ms. Selva for comparing the event beautifully. Thank you, Selva. I thank Mr. Daryl, Zoom coordinator, system administrator Salil, Joel Nelson, and Jisil towards the timely technical support. Thank you for your help. My special thanks to Dr. Umesh Beatty and Ms. Minu Muhammad for their external support, suggestions, and motivation. On behalf of International Conference Esperanza, I convey my gratitude to all physical educators, physiotherapy professional for your interest to participate in this event. On behalf of organizing committee, my special thanks to the head of the departments, teaching and non-teaching staff and students of MES College Marampally and CHMKM Government Arts and Science College Stanor for your valuable time. I express my thanks to press and media for nice coverage of the event. I hope we could organize such event again and again. Thank you all. Have a nice day.
Thank you so much, sir. So here is the official end of Esperanza 2k20, and we are wrapping up our conference right now. So I want to express my sincere gratitude to each and everyone who has supported us all the way through, and really hoping for your continued support for all the future endeavors too. And I would like to sum up with these lines. A good event never ends in the world. They take only a pause and keep awaiting for the next. Thank you so much. Have a great day.
Thank you.